knowledge and mobilization, that's why we're here. What is it? Put simply, knowledge mobilization, or KMB, is the process of moving evidence into action to maximize impact. The Canadian Institutes of Health Research, or CIHR, defines knowledge mobilization as a wide array of activities such as integrated knowledge translation, knowledge creation, dissemination, and implementation related to both the production and use of research results. It focuses on turning research knowledge into practice and policy by making information readily accessible. Sorry, I'm having issues. Thank you. So knowledge mobilization, I put together these quick notes with thanks to an article from University of Calgary. Knowledge mobilization can happen at any point of the research process. These knowledge mobilization initiatives can inform public debate, policy, and decision-making, and improve services and processes. It can be co-created and co-facilitated by researchers and the community. Knowledge mobilization ensures that knowledge gained through research is accessible to knowledge users in various formats and not just stored in academic journals. Here's an example. Let's say that researchers found that dark chocolate offers potential health benefits. They only shared that knowledge in academic journals. So little Susie's with her mom, and she asks her mom for dark chocolate. But all her mom has heard is that, well, chocolate's candy and candy's bad. So mom says, no, chocolate is bad. If her mom had read the articles in the journal, or really if that information had been shared in a format outside of academia, Susie could have enjoyed a potentially beneficial treat, but instead she's offered a slice of cucumber, and that's sad. So this sharing of knowledge in appropriate formats for different knowledge users makes research matter. Other terms for these activities include knowledge exchange, knowledge translation, and implementation. Here on this slide are different types of knowledge mobilization outputs, and they'll be discussed later in the webinar. So these are just a few examples. So traditional outputs, journal articles, conference posters, and then non-traditional outputs, which we're starting to see more of: videos, infographics, podcasts, and storybooks. And these here are just a few that I've actually worked on personally. So different organizations have created tools to help researchers create knowledge mobilization plans. These are referenced at the end of the presentation. I prefer the knowledge translation planning template that was created by Melanie Barwick at Sick Kids. In the template are steps of a KT plan. Stephanie will be speaking about the first few items mentioned here, and I'll be focusing on the ones in bold, and then Arjuri will be going into more depth about the strategies. So it can be tempting to decide a knowledge mobilization strategy as soon as there's knowledge to share, but resist. Before identifying knowledge mobilization strategies, it's important to identify who the knowledge users will be, who will benefit from this knowledge. And next, you're going to tailor the messages for each type of knowledge user. These main messages need to be brief, actionable, and clear. They need to be specific to the knowledge users. And you can look at the SMIT, or single most important thing, or the BLAM, the bottom line actionable message. Let's look a little closer at the knowledge mobilization goals. So the goals could be to generate awareness or interest, share knowledge. Uh, they could be to inform decision making. They could be for the purpose of commercialization or technology transfer. Um, they could be to inform research or facilitate policy change. And finally, they could be to facilitate practice or behavior change. In the case of any practice or behavior change, a implementation plan would be required. And we won't talk at length about that. So moving on. So we've now talked about the knowledge users. And the knowledge users can and they likely will overlap with the project team and project partners. And Stephanie will address this a little bit later. Note that the main message may change as research is conducted and findings are interpreted. It's important to tailor the message to your audience. So if you're talking, if there's a message, the knowledge users are the public. It's important to use plain language and different types of plain language tools, such as the use of tables and charts, infographics, pictures, and Stephanie and Arjay will both talk about language, the importance of language a little bit later. After you've identified these knowledge users and main messages, you're then going to go over to the goals. And the goals are important in order to dictate what strategies will be used. So it's very important that the knowledge users, main messages, goals, and strategies are all in alignment. Strategies will be discussed shortly, but let's first look at an example. In clinical research trials, researchers have recently discovered that purple water helps digestion. Of course, this is fictional. Who are the knowledge users here? It's the public. What's the main message? Drinking purple water aids digestion. What's the goal? It's to encourage people to drink purple water. So then what strategy? From research to real world application, how does it happen? And that is the strategies. So how does a team determine the strategy to use? These can be, they're based on the goals. They can be role-based, educational, or art-based. Different factors influence the strategies that may be used, such as resource, budget, timeline, team member capabilities. For example, you might have very creative people on your team. Let's use the previous example of the groundbreaking research that drinking purple water aids digestion. We want to generate awareness. Although we could also have the goal of facilitating behavior change, we have a limited budget and we're short on time, so we're going to stick with one goal. The KMB strategy in this case might be a social media campaign just to share the knowledge. If we did want to also encourage behavior change, actually getting that buy-in, getting people to drink more purple water, we would begin with a dissemination goal of informing to create that buy-in. And then finally, if you are interested in learning more about what I just shared, you'll find helpful resources at the page noted. Melanie Barwick at SickKids offers many paid and free courses about knowledge translation. I will now turn this over to Stephanie.
Hi, everyone. As mentioned earlier, I'm Stephanie. I am a registered social worker as well as a person with lived experience and a lead with the knowledge mobilization. So today I'm going to be discussing the importance of collaboration in pediatric oncology, particularly the involvement, co-creation, and voices of patients, families, and persons with lived or living experience. Knowledge mobilization within pediatric oncology is a collaborative process that links research, practice, and patient and family perspectives. Collaboration strengthens the ethical practices, democratizes the research process, and supports the translation of knowledge into action, making the findings usable and valuable across diverse sectors. Drawing from both personal and professional experience, I'll be talking about how meaningful engagement within knowledge mobilization can make research more relevant, accessible, and impactful. I'm going to explore the benefits of co-creating with PWLEs, from shaping research questions to designing tools and sharing findings, and offer practical ways we can build inclusive, equity-driven partnerships that truly reflect the needs of the community. So, partner roles and meaningful engagements. Researchers can and should meaningfully engage people with lived experience in ways that foster ownership, empowerment, active participation, and authentic representation. When PWLEs are included in research, not just as participants, but as partners, researchers can ensure that PWLEs' perspectives are truly represented and valued. Empowering PWLEs means recognizing them as experts in their own experiences, because when they feel valued, confident, and in control, we can create more inclusive, relevant, and impactful research outcomes. This help challenges the traditional power imbalances often found in research settings by creating authentic relationships and collaborating with community organizations. We can then foster more awareness, acceptance, and accessibility. These efforts don't just benefit the research, it helps to build trust and sustainable change. When research is a collaborative process, it vastly enhances the quality of the process, the findings, and the outcomes. Including a variety of project partners, such as PWLEs, as well as community members, improves the generalizability of the data and enacts change in their own community, leading to capacity building as well as long-term changes. So partner roles and meaningful engagement highlights the needs of marginalized populations, as well as addressing existing barriers and gaps, which can otherwise impact the effectiveness of knowledge mobilization efforts. Research who are outside to the end users community can lack the necessary information to develop deep structure cultural sensitivity on their own. Engaging directly with community members and partners can provide valuable insider perspective on culturally sensitive practices that improve patient knowledge and inform health decision-making specific to the diverse community members within Canada. As researchers and healthcare providers, we must ensure that the research conducted has meaningful real-world impacts by making the findings accessible, relevant, and valuable to the individuals and communities who need them the most. Careful planning, considering meaningful engagement, and being intentional about the best methods and main messages to use is key. Collaborating with project partners and PWLEs ensures that meaningful and impactful content is translatable, culturally relevant, and age appropriate through visuals, terminology, sensitivity to the group's lived experiences, as well as making the information more effective and appropriate for the end users. Knowledge mobilization within pediatric oncology is and should be a collaborative process, from the planning, developing, implementation, and then evaluation. Collaborating with project partners is essential for making research not only inclusive, but more impactful. When PWLEs are actively involved in shaping the research process, from setting research priorities to designing methodologies, the research becomes far more relevant, accessible, and grounded in real-world needs. Studies show that when co-creation of research protocols at the beginning includes PWLE, meaningful research leads to more meaningful questions, improved recruitment strategies, and better outcomes in knowledge mobilization. PWLE involvement at the start enhances the quality of data collection, analysis, and ensures the knowledge synthesis and dissemination efforts reach and resonate with the intended communities. PWLEs bring firsthand insight that helps shape how information is shared through the most effective and accessible formats, whether through storytelling, creative media, community-led events, interactive formats. These diverse formats go far beyond academic papers. They can include zines, infographics, podcasts, workshops, comic strips, digital platforms, nuanced visuals, relevant terms and definitions. Patient partner engagement is very important as it brings forward the voice of patients and families, influences study designs, and assists in the dissemination of knowledge. When PWLEs are part of the design and dissemination process from start to finish, the result is knowledge that better reflects community needs, languages, and values. For example, Karen, who spoke earlier, was involved in a MET-MED trial, which is a strong example of PWLE-driven knowledge mobilization collaboration. As a patient partner, Karen was involved from the grant stage, shaping the study protocol, consent forms, and lay summary. She chairs the stakeholder engagement committee, ensuring patients and family perspectives are embedded into all aspects of the study. Karen also co-developed a plain language pamphlet with the team's knowledge mobilization specialist to support families considering participation. Her contributions show how engaging PWLEs leads to more accessible, relevant, and patient-centered research. Which brings us to the language and why language matters. When conducting knowledge mobilization, simply translating language or knowledge mobilization does not ensure that the main message is accessible or meaningful. Whether that is through pediatric oncologists speaking to colleagues at a research conference or a PWLE supporting legislation development with policy makers, language can vary depending on the context. Language can be very specific to a specific group of target users or generalized to the general public. By ensuring that the language style of your product matches the language style of your audience, you'll further build upon trust with your knowledge users and provide yourself with credibility. When people are able to understand medical jargon easier, they are more inclined to take in that information and act upon it. By leveling out the language to the level of your users, you're able to position yourself at their level of understanding and balance the power dynamics. Language must also include EDI and be culturally informed, ensuring that decolonized terminology is being used and emphasizes reciprocal knowledge sharing. As knowledge mobilization outputs can vary in format, language should match the path of the exchange. When communicating with the general public, it's important to consider and use plain language. Using plain language and partnering with PWLEs is not just good practice. It's essential for ethical, accessible, and effective knowledge mobilization within pediatric cancer. Plain language is more than using simple words. It's about clear communication. It ensures that parents and children aren't left confused by medical jargon. It enables our patients and their families to understand what's happening to them, and that information is accessible to people of all literacy levels, languages, and cultural backgrounds. It involves writing outputs in clear, concise, and user-friendly formats that help patients and families make vital healthcare decisions and inform health-related behaviors, using short sentences, everyday words, active voice, and visuals when needed. This practice ensures that we are putting the readers and our users first, whether that's a parent trying to understand side effects of a young person or a young person wanting to know what's to be expected during treatment. Plain language improves accessibility, engagement, health literacy, actionability, as well as equity. To provide context, here is an example of a knowledge mobilization initiative we are working on within ACCESS. The Special Access Frontiers for Young Minds collection, which will be dedicated to pediatric cancer, encompasses all of the essential factors of meaningful engagement of PWLEs, such as co-creation, diverse and engaging formats, cultural relevance, and lay language. Frontiers for Young Minds is a peer-reviewed scientific journal where articles are written for scientists for young audience and uniquely reviewed by children and youth with support from science mentors. This model creates a space where young people can actively shape how complex science is communicated. Within ACCESS, patients, survivors, siblings, community members, anybody affected by pediatric cancer can be involved in actively shaping how complex science is communicated to produce an output that is relevant and accessible for the communities we all aim to support. Frontiers for Young Minds is a powerful example of how PWLE involvement can simplify science, transform the knowledge, and who is able to access it, and how it aims to serve our most vulnerable users. Finally, I've provided some other examples to which you can access later. One is an article that was recently published. This article emphasizes the critical role of language that centers patient perspectives within oncology communication. And it's authored by a collaborative interdisciplinary team that included both scientists and patient partners. It's a wonderful example of how basic science or basic scientists can apply these concepts into real world interactions. And for that, I'm going to now turn it over to Archery.
Thank you, Stephanie and Karen. Thank you to all those in the chat who have posted who they are and where they're coming from. So what I see is that we have a really rich, diverse audience from PWLEs to clinicians to scientists and trainees. So feel free to keep on adding more, but what I'm going to do is mindful of that I'm speaking to a broad audience. I'll keep that in mind as I go through the slides. So we have our two classic presentations, publications, both conference and publications, which are the peer-reviewed publications, which we need to publish in open access journals. Tricia, keep on going. Next one. So what I want to show was, thanks to COVID, what happened was that there was a huge shift where we were able to connect internationally, globally, online. And so with that, the momentum continues. Tricia, next slide, please. With PsyOp, which has, in terms of registration that's going on, along with your late abstract submissions, the opportunity to participate in this conference online. So this is a very good opportunity for students, especially who don't have the financial means to get to Amsterdam, but can actually still submit something and present locally, but globally. And so you'd want to keep on doing that along the way as you get your knowledge out. Next one. So I'm going to briefly just kind of share some of the latest trends and poster presentations, which because I started my career in child health, there was always being mindful that perhaps my audience might also be children. So I've always used a lot of visuals in my posters. And this is some of the earlier work about CSOM. Tricia, next, please. But the trend to keep on going and to use a lot more visual than relying solely on text continues. So I would encourage you all to consider how can you balance text and visual as you continue to create your new poster presentations. Next slide. These are just some examples of some award-winning posters, but you'll see how there's more of a balance between the text and the visual and a color scheme. Next one, Tricia. This is a proposed revolution in scientific conference posters, which we'll share the link afterwards. But in the end, this person proposes to have a poster presentation that looks quite different than what we're used to. So Tricia, next one. Which looks like this. And the purpose is that because he says that nobody really spends much time on your posters. So if you can just put your main summary, finding in the middle, have a QR code that goes to certain text and offer more of the text on the far right and left. This is obviously a choice, but if you are interested in more, you can take a look at the links below and you can download the templates that this individual, Mike Morrison, has suggested. In the prior poster plus ongoing reminder of the use of QR codes that allows for far more interactivity. You can engage with your audience more after the poster presentation. And depending on the license that you buy, you can actually keep track of who's looking at your posters globally. So you'll be able to track where the links are coming, where the clicks are coming from what countries. Okay. Next. So there was, I quickly did what are some other emerging trends in poster designs. And so I suggest that you kind of take a look at some of the topics. Next slide. But it's also trying to think about the evolution of all the data visualization tools, the use of AI. They need to be sustainable, how you need to cross disciplines to influence your designs. So those are all the different topics that are coming through, and you'll have the link. Now, in terms of publications, I'm offering you for those who struggle and procrastinate when it comes to writing, Madupai has a whole series of different resources for you in case you're in that bucket and having difficulty get your work out the door. Okay. In the meantime, once it gets out the door, there is a momentum now for journals to want to publish plain language summaries. So that's your summary text that you need to publish. Next one, it will also be your visual, so all your graphics, and then the PLS of publication. So that's the standalone articles. So the one that Stephanie just mentioned can serve as an example. That's the Young Minds. So with this website, you have access to some resources for you to see how to do that. Next one's Trisha, please. And then this is a new tool that I recently encountered by a group of scientists in Israel. So what you do is you take your text, throw it into their software, and they will highlight where all the jargon is. That will help you remove that jargon as you try to simplify your text. Next one. Then also there's a greater movement to be able to create graphic abstracts. So what you can do is pay for that service. So Wiley offers that if you like, or, take advantage of the talented trainees in your lab to be able to do that as well. Next slide has a few examples for you. So these are some examples I just found on doing a little bit of a search in the context of pediatric oncology. Okay, so those are examples. The other area when it comes to publishing your work, you might be able to be in a position to buy, to be featured on the cover. And that's what happened with me with some of the work that I had done. So I was featured on the cover a few times in pediatric oncology, but internally Wiley had created a piece about the work that I had done in related to financial toxicity in India. So this is something else, another way that when you have your work published with a journal, these are some of the opportunities that may come. Next, Trisha. Thanks for the claps. And then finally, the reminder for the lay audience, which is a great way to try to get your work republished. It counts as another publication for you, but it really intends to hit that lay audience for you. Okay, next. So once you have all your publications, then you have to take advantage of all those different platforms that are available for you. So if you don't have these, create your Scopus, create your Google Scholar account, look at your ResearchGate, and then also try to take a look at where you can publish your stuff in an open access repository if you don't have the $3,000, $5,000, or $20,000 that you need to publish open access with some of the fancier journals. But this is the intent of just trying to move that forward. So the reason why today we particularly wanted to focus on your infographics, videos, and podcasts is because every fall there's a competition with the CI Child Health Institute. So you have the opportunity now this summer to see if you're ready to do it. You register in around September, and usually the official competition where you have to vote online starts for the whole month of November. So I'm going to show you some examples and see whether or not this could be something that ACCESS would like to join in. Last year was a huge competition where they had loads and loads of submissions, and I've included number 1 and number 2 of the winners who won the infographics. But when you go to the link, you'll see multiple different examples of an infographic and what were some of the award-winning ones and what were other ones that also received some commendations. Next. In the context of pediatric oncology, this is a beautiful infographic, and it was part of a social media campaign now many years ago, but to help with the stigmatization associated with being bald. And this was a campaign that came out of Brazil. This is another infographic example that comes from the community. Next. For myself, I'm part of a bone and oral health research network where we had collaborated with graphic designers who, as part of this series of comic strips, had created one about me as well. But this is another example of utilizing graphics to use them to create infographics. Next. Okay, and what I want to say is that trainees come with multiple talents. So for those who, and our PWLEs, so take a look at what you have around you and leverage those skill sets to create some beautiful images. Next we go. Now, options when it comes to videos, you also have the opportunity to create them, but also to publish them as well and be part of competitions. So I'm going to give you 3 quick examples of where I've taken some of the work that I've done. Next slide, Tricia. The body of work that I had done in pain with children with a rare bone condition led to the creation of a song where, with my student, the far right, and Stephanie Smith, we actually created a music video, which then you can go, keep on going, which we created a storyboard, submitted it to a Montreal film festival. Off you go, next one. We'll skip that. You can have the link and you can see it later. I just want to show where it went. It went then to the film festival, keep on going. Then it went to an international French Congress, but we also submitted to the WHO Film Festival. So that is an option for everybody, in that every year there's a film festival for health. So if you opt to create a video, you can submit it there, and there actually happens to be an example in pediatric oncology. Off you go, next one. This work was then used to actually be featured at a PWLE event for a different condition, but it was the opening event. It was the opening song to the 3-day congress. Okay, so that shows where it could possibly go. Next. We've also used our research to inform the creation of coloring books for children. So these are some of the visuals when it comes to pain. Next. And then you'll put the link in there, but this has led to the creation of an animated video that teaches children what they can do when they're experiencing pain. This video did go to the CIHR competition, but this one I didn't win. So I'm going to try for another video this year. Next. I won't show it. I'll show you the one that did win. Well, I'll let you know which one did win. The one that did win happens to be about why children, these children experience severe constipation. And so that led to the creation of another video about how to have a successful poop after surgery, which is this one, that won a special commendation in 2022. And so the team will put that link as well. And amongst all the different PWLEs happened to be my son as well, who offered some input. Next, our podcasts, which Jessica Ding is a trainee, which is graduated. When we were looking to see how on earth do you create a podcast, it looks like that there wasn't much research on it. So we actually created a step-by-step guide for all of our novice people on how to do it. So these are the 7 steps that we've come up with, where, understanding your audience, select your interviewees, recruit for the podcast, create your interview guides, conduct your interviews, create the podcast itself, create the visual content, and then for that, create the dissemination strategy. But we're very fortunate within ACCESS. We have Sam Taylor, who has a beautiful series called The Deep Sea. And she's a PWLE within ACCESS. And we also have Monica Molinaro, next slide, who also created a podcast series based on her PhD work about the moral distress of pediatric oncology nurses. So what we hope to do is to compile all these beautiful networks together to further support ACCESS moving forward. Next. So I'm offering you just a few little resources here for the infographics, videos, podcast. You're most welcome to reach out to us for more. And from there, we'll go to the next slide. Because I acknowledge I've done a lot of many different things. And so if you have, I don't know if anybody in the chat has a question right now about other types of potential knowledge mobilization outputs, I can answer a question, or we can leave it to the end, whatever you like. I don't see some, but I'm going to just keep on going. Oh, these are for basic scientists. So there are some readings here for those about how do you go from bench to bedside as a basic scientist to be able to mobilize your knowledge. You can go to the next one. And the work that Stephanie had just showed about Julia Bernier, she's in the research discovery phase, which is the far left of this map, of this diagram, where she's about the knowledge creation, all that. And she has figured out a way to engage the PWLEs from that discovery phase. And so you want to be able to see how can you work that out within your own program of research. So you don't wait till the tail end where you're just disseminating that work. Next steps for myself and for the team here. We have 3 ongoing environmental scans, which are almost near completion. However, the environmental scan of Canada, taking a look at all the non-for-profits, and I think there were 17 of them, show that we're very strong collectively at using social media, creating blogs, doing stuff in person, creating newsletters, creating videos, and generating reports. So that's a very good potential area for partnership for those who haven't done this body of work and would like to do so in collaboration with those who are experts. Along this series, and you'll see less and less of the non-for-profits who collectively do all this, but they are engaged with many ways of getting the knowledge out. Globally, you'll see that, Tricia, you can go to the next one. Globally, you can see there's an abundance of the use of videos and blogs, in-person training and pamphlets. This is just early work, because I think we had identified about, I don't know if it was 130 or 160, but we had identified quite a few non-for-profits globally. So that work is still being analyzed. And then next one. And then, so we had an example from a high-income country. Now we have an example from a low-income country, which is India. So we know that in India, they're using many different social media platforms as well. And there's a tremendous reliance on posters, infographics, blogs, newsletters, and videos to get the message out. So you know that collectively, these non-for-profits are engaged in this type of work. And so I would suggest reaching out to them if ever you want to reach a broader audience. Next steps for us is that get ready. After spending quite a few months to develop these surveys on REDCap, they're coming. They're coming for you. With that, we want to hear about what are your knowledge mobilization needs as a survey, and to welcome you to join a focus group. All that will be lined up for you to participate, which will help us collectively inform all of our strategic decisions together. We also have another study that is designed for the children. It's under ethical review. The revisions have been submitted, but we're going to be asking the kids as well what, how, when, where, what they want to receive their information as, and what formats. So we created a questionnaire because none of this work existed, but that is coming too. So I would really appreciate it if you could share that with the children and encourage them to complete it as well. Next, Tricia. And here we are. in terms of where we're at. And if any of you would like to join us, would like to do something with us, please do not hesitate to reach out, and we'll troubleshoot and figure out how we can all continue to move forward together. You have all of our emails and contacts. And after that, I don't think, Trisha, is there another slide after that? I can't remember. No. And with that, so I managed to get through it all, which gives us 15 minutes, I hope, for some discussion, for some chat, because this actually helps us in terms of understanding your needs and moving things forward. We have silence. So how many want to consider doing a CIHR competition submission? Is there a way that they can raise hands or something? Oh, I got a new message. In there, Chrissy, but my idea is communicating a basic research concept, looking at previous entries. I'm not sure. Yes, it is suitable. So it's whether or not how you want to communicate this. Do you want to try to do it as an infographic or in a video? A podcast might be a little bit too long to do this unless you feel that's the direction you want to go. Can you sketch it out first as an infographic? Yeah. So then from the infographic, try to sketch it out. You can play around with Canva or Microsoft, just even the PowerPoint to see visually, unless you yourself have an artistic lens or someone with your team. We use Canva quite a bit to create some beautiful infographics. So that's something you can try. You can probably get a free license for a bit. And I would also, yeah, good. And then take a look at some of the infographics that won last year. The other website that I produces beautiful infographics is Skip, Solution for Kids in Pain, which is led by Christine Chambers. And if you want further free consultation, Children's Healthcare Canada offers, I think, 30 minutes of free consultation. After that, you pay them. Anybody else? I got my thumbs up. Anybody going to tackle doing a podcast or wants to within the upcoming year? No, nobody wants to do a podcast. Anybody wants to be interviewed for one? Yes, I agree, Dawn, and that's why we got Sam Taylor, because you told me about Sam. So yes, we very much want to do that, and we'll figure out how we can do that along the way. It could be compiling a list of which who would we like to interview. I can also ask Emily if she has any AYA suggestions. Yeah.
For the sake of everyone watching this after the fact, Dawn had mentioned that she would love to see someone from the AYA space do a podcast. That's what Archery was referencing.
Yeah, I'm reading the messages as we go along. Okay, Julia, you've been trying to get a podcast on learning health systems and embedded research up and running on the learning system. And did you figure it out? Were you able to get it integrated into the learning system? Now we have a teenage, Trisha, we'll be able to keep that link for us for reference that Kirsty sent us. Time is undeciding factor so far. On learning health system. Julie, are you able to expand a little bit about that? I guess Julia can't speak. Is that's been disabled? Learning curve seems steep in terms of edit. Yes, time and issue. Okay, so Julia, what we can at least offer Jessica Ding is her manuscript is almost ready, but in terms of kind of some of the editing stuff and things to consider, I can connect you with Jessica, my student. But then the other two people that I know within our network who are experts are Sam Taylor and Monica Molinaro, if they're able to be of any assistance. The other people who Children's Healthcare Canada has a beautiful podcast series as well, and so they offer consultation, so they might be more equipped to be able to offer that. Hi, Catherine. This is a girl. So, but I'm curious as to what the project.
If you, sorry, while Audrey is reading that current message, for those who do have a question, if you raise your hand, one of the members of the Secretariat can unmute you.
Okay, so I can speak, Catherine, personally for me, when it comes to conducting the research, it's always extremely interdisciplinary. So I often include all the different clinical disciplines involved, and then hired as part of my research staff is often a PWLE, or I also have students who are chronically ill who come my way as well. So there's always that PWLE influence throughout the work that I do. And so that's just within the healthcare. Then the video you saw with Stephanie is an animator. So she has a bachelor's in fine arts. So I go outside healthcare expertise, and I often engage with artists and engineers to move some of the work that we're doing. Sometimes we partner with industry as well to move the different projects forward. So I really try to, it really depends on the product, but try to be as broad as possible. Broad and inclusive. Okay. Vera, you did one? Oh, no. Oh, good. So we have Vera's example too for a podcast. Excellent, Vera. Thank you for sharing. So we can add that to the slide deck. So we know that one person is looking for CI chair competition amongst everybody. Hopefully by the end of summer, there might be a few more actually willing to take the plunge and give it a shot. Okay. Anybody submitting for PSYOP for the late abstract? Oh, we have a question by Christy.
Hi. Just thought I would unmute rather than typing in the chat. You mentioned about Children's Healthcare Canada that you could have a consultation. I just wondered if you could expand on that a bit because I haven't heard about that before.
So Children's Healthcare Canada has created a beautiful knowledge mobilization hub, which is called Spark. And within that, they offer a range of consultation services. I'm just opening it up. So they offer a range of consultation services, which the first part is free, but then they have a list of all the different potential outputs that they can create and what would be the cost associated with it.
Oh, okay.
Okay, so that is one beautiful resource that is available to the community if they would like to utilize.
Okay, great. Thank you.
It depends. Is there a one-stop shop where we can get access to all the links to websites, information, resources that have been? Emily, you can have all my slides, and that will be available on the website. So you can click away on all of those. The one-stop shop. And yes, we are trying to establish a knowledge mobilization hub. There is just a tremendous amount of preliminary work that needed to know who we all are and where do our strengths lie, so that you can leverage all the different non-for-profits as well and know who's doing what and where, and to recognize what has been done prior. There's one more scan that we're trying to do, which is an environmental scan of all the child health research networks and all the different types of knowledge mobilization products they're creating. So we don't replicate, but overlap in a sense and build on each other's strengths. Karen?
Yeah, let's pull Genevieve's question in there or comment. Thanks for the nice presentation. How can you tell that a knowledge mobilization output has been useful or successful? It's an excellent question. And actually having an evaluation plan is part of your knowledge translation or knowledge mobilization plan. We didn't get a chance to touch on that, but in the resources that will be shared, there is access for that.
Yeah, I know Krish is on. Genevieve, there's a really, really good scoping review paper that just came out, and I need to find it to be able to give it to you. But it will explain all the different ways of considering how to evaluate. So you can use the KT framework template, but more of a sophisticated, in-depth explanation of the things. I think maybe what we can do is follow up and send that paper to people. I myself am trying to figure all of this out as well, because your evaluation is what? Is it for, let's say, your social media? Are you going to do your followers? Are you going to do your metrics? Are you, in terms of what are meaningful markers of evaluation, what are you looking at? So we'll get you that paper, and maybe what we can do is a follow-up about how do you evaluate your knowledge mobilization strategies. Would that be okay with everybody? Yes, that one. Thank you, Krish. There you go. Genevieve, you have that paper. I think that one's going to help. We're still dissecting it to help us figure things out as well. I can tell you, when we introduced virtual reality to the hospital, some of the metrics was that the nurse manager could keep her office door open now for meetings because she didn't have to close it for the crying. You know, the VR headsets were used so much that the battery constantly ran out. So it depends on the types of metrics you want to look at and what are meaningful, and who, and different people want to know different evaluation outputs and metrics. Christy, yes. Timeline for this. Do you want to speak to it? But I would continue to submit to them.
We're
Yeah,
working. Oh, sorry. Go,
Sorry,
Trisha.
just to add to that, Kirsty, yes, there is a timeline. We are currently working on our end to have the committee of collection editors review all the submissions, because there were a fair number of them. And we hope to get back by the end of August to everybody who submitted an idea that we would like to move forward for the first special collection. I think what Ardrey was maybe mentioning was that if you have subsequent things or subsequent ideas for articles, that you absolutely should go ahead and submit them through the regular mechanism to Frontiers for Young Minds.
There really isn't much about pediatric oncology and Young Minds Frontiers, so please really start start submitting. You have the opportunity to rewrite your research papers, and you have the opportunity to write core concept papers. So please take advantage of that. We've published one. I have another one submitted, and I have students who are redrafting a number of our papers, because we really want the research that we do is also readable for the children and their families. And this is an excellent mechanism to do so.